We want to thank our sponsors, the Blue Shield of California Foundation and the National Health Resource Center on Domestic Violence, a project of Futures Without Violence. Reminder also, this year we have a self-care room, so make sure that you visit that. That is over in Cabrillo, which is, when you walk out, it's sort of right across the hall from you. There's also, if you want CEUs, there's a table out there to sign up for that. And we are going to have raffles throughout the day. And do you have to be here to win? Yes, you have to be here to win. So please stay till the end. And there are index cards and pens on the tables to submit any questions. And folks will be walking around with mics, right? Okay. And we also have a very special networking reception at 3:30, and word is that there may be a DJ there, so make sure you stick around for that. And there will be also hors d'oeuvres. So, okay, we are going to get started now as soon as I can pull up my thing. So, welcome, everyone. Thank you so much for being here with us today. My name is Kate Marr. I'm the Executive Director of Community Legal Aid SoCal, and I'm also a member of the Leadership Council for Domestic Violence and Healthcare here in Los Angeles County. It's really great to see such a large group of folks here today. This is actually our fourth semi-annual because we took a year off for COVID. And second, fully in-person Beyond Silos event. And we are so grateful that you're all here with us today. So this event grew out of, what I like to say, a little seed that grew out of a little seed. Several years ago, the partners that make up the Leadership Council were all part of a Blue Shield of California Foundation funded project where we all were partnering with healthcare providers to work with survivors of domestic violence. And the results were pretty remarkable. And you can visit our website to see sort of the results of those projects. But as that funding was coming to a close, several of us, Genesee Center, East LA Women's Center, the YWCA of San Gabriel Valley, and my organization had an idea. We wanted to see how we could take the lessons learned from our individual projects and create sustainable progress for DV survivors in Los Angeles County. And out of that, the Leadership Council was born. And in 2019, the Leadership Council partnered with the LA County Domestic Violence Council and the LA County Department of Public Health to host what we thought at the time would be a one-time only symposium, Beyond Silos. Our goal was to bring together leaders from the fields of domestic violence and healthcare, two fields that don't typically work together, to talk about how we can improve health outcomes for victims and survivors of DV by partnering with one another. So the response was pretty amazing to our first symposium, and here we are, 4 years later. So thank you again for joining us. We hope that you all walk away from this event inspired to work in partnership to improve responses to domestic violence and its health impacts, and advance policy and systems change in intersectional approaches to communities impacted by violence here in Los Angeles County. Now, I have the pleasure of introducing one of our partners in this work, Pham, who is the Executive Director of the LA County Domestic Violence Council. So those of you that aren't familiar with the DVC, they provide leadership in creation and support of a victim-centered, county-wide, and coordinated approach to educate, prevent, and respond to domestic and intimate partner violence. Prior to joining the DVC, Ms. Pham was manager of the City of Seattle's Mayor's Office on Domestic Violence and Sexual Assault, where she led Seattle's response to gender-based violence. Welcome, Lan.
Thank you, Kate, and good morning, everyone. Nice to see everyone. Again, my name is Pham, and I'm the Executive Director of LA County Domestic Violence Council. It's wonderful to be with you this morning. I'm using script because I have a tendency to go off script, which I will use way over my time. It's wonderful for me to be with you this morning, and while I enjoy being surrounded by like-minded colleagues, I know that, like me, you wish that we were here for a more joyous occasion, rather than the need to address the ongoing violence in our community. However, I believe that you are also here because we share the hope and the vision for a future without violence. Thus, for this moment in time, let us join in our collective effort to prevent, intervene, and improve access and response for survivors. First, I'd like to thank the Leadership Council for Domestic Violence in Healthcare, the Genesee Center, Inc., East LA Women's Center, Community Legal Aid SoCal, and the YWCA of San Gabriel Valley for co-hosting this event. Thank you. So please join me in thanking them. I also want to acknowledge Kate Marr and Barbara Capos, who are also co-chairs of the Domestic Violence Council Health Committee, so thank you. Yasmin Tarver, Director of the Workforce Development, and also Jennifer Haddett-Bell, Program Consultant, for their leadership and many hours in the planning, coordinating to ensure that we have the space to gather, to share, to learn, and to connect today. So please join me in thanking them. We all bring who we are to what we do, and I know that you are here because of your own experience, or that you carry the experiences of your clients, of your patients, and of your family members and loved ones. Oh, okay, thank you. And you are using that experience to ignite your commitment and passion to addressing and ending domestic violence. So as Kate mentioned, I joined the DVC about 6 months ago, coming from Seattle. So I'll share with you a little bit about my experience while I was in Seattle. So in 1995, I was an intern at the King County Courthouse in Seattle, Washington, when shots rang out on the second floor of the building. I was on the fourth floor. I later learned that a young woman who was getting a divorce, or actually an annulment because she was just recently married, from her husband was shot and killed, and along with her, two of her supporters who were also her friends who accompanied her that day. She was 26 years old, 8 months pregnant, and the baby was also killed. Susana Retamerta was from the Philippines with no family or friends in the United States. Phoebe DeZone and Veronica Loretta Johnson were members of the Seattle Filipino Community Center who provided Susana with shelter and supported her when she fled from her abusive husband. During her short marriage, she was emotionally, verbally, and physically abused, including being hit and choked. Domestic violence is not a standalone issue. It is complicated. People's lives and situations are complicated. Systems are challenging and difficult to navigate. Many survivors are isolated, scared, alone, and usually do not know who or where they can turn to or who they can trust. Although domestic violence does not discriminate, survivors from historically marginalized communities and LGBTQIA+ communities experience domestic violence at a disproportionately higher rate due to lack of access, lack of resources, and lack of culturally and linguistically appropriate response and resources. According to a report by the Blue Shield California Foundation, Black women in California face even higher rates of domestic violence compared to other racial groups. And according to the Bureau of Justice Statistics, during the period of 2017 to 2020, the rate of violence victimization of lesbian or gay persons was more than 2 times the rate for straight persons. The rate of violence victimization against transgender persons was 2.5 times the rate among cisgender persons. Domestic violence was 8 times as high among bisexual persons and more than twice as high among lesbian or gay persons as it was among straight persons. And from our own DVC's recent listening sessions that we held at the end of August, we learned about the multiple intersecting challenges such as language access, immigration status, lack of legal support, financial options, fear and distrust of systems, which forces many undocumented and immigrant survivors to remain in isolation. Some return to their abusers, and others risk further victimization and exploitation during their journey to safety. Because domestic violence is not a standalone issue, ending domestic violence requires a trauma-informed, culturally and linguistically relevant, coordinated community response. That is why we are here today, and we are here as part of a larger effort to continuously learn, grow, and improve access and response for all survivors. After the death of Susanna, several Filipino community members established a Natural Helpers program within the Seattle Filipino Community Center. And until today, the FCC DV Education Committee still exists and have trained countless community members on how they can better support family and friends who are survivors, regardless of whether they want to report the abuse or not. The death of Susanna, Phoebe, and Veronica also prompted the Asian and Pacific community in Seattle to establish a nonprofit to support survivors of domestic violence, sexual assault, and human trafficking called the API Women and Family Safety Center, now called API Chaya. And that was an organization that I was lucky enough to volunteer at and later worked at as executive director from 2005 to 2010. To date, the organization has supported thousands of survivors and built survivor leadership to address and prevent violence. The death of Susanna also established the API DV Consortium to enhance response for immigrant survivors, as well as started the Peace in the Home hotline for limited English survivors. So I share with you the story of Susanna as a reminder that there is power in community and that it is of the utmost importance that we honor the lives of survivors, those that are lost, as well as those who are living among us. And while we're pulled out or pulled into the work due to the tragedies in our own lives or the lives of our loved ones, it is with the same energy that we use to ignite change. So you are here as a part of that change. I thank you for taking the time to be here. I thank you for caring. I thank you for doing what you do every day and for honoring survivors and for being a partner. And I'm grateful for the presence of all of us today in unity and breaking silos and to be a partner in this collective effort to address and end domestic violence in our communities. So thank you for your time, and I look forward to working with all of you.
Thank you so much. Now I have the pleasure of introducing another partner, Richard Thomason. Richard serves as Director of Policy at Blue Shield of California Foundation, where he leads the development of initiatives that leverage public policy to achieve the foundation's mission. Mr. Thomason joined the foundation in 2009 and has led the foundation's efforts to make California the healthiest state, expand health coverage, improve access to care for vulnerable populations, and strengthen safety net healthcare systems. Prior to joining the foundation, Mr. Thomason was the policy director for SEIU, United Healthcare, deeply involved in the full range of healthcare reform and healthcare systems issues facing SEIU and its membership. Welcome, Richard.
Great, thank you, Kate. So I'm really pleased to be here again with all of you at the Leadership Council. This theme of this conference about breaking silos to break the cycle of domestic violence is really important to us at Blue Shield of California Foundation. So I too want to express my thanks to all of you for being here today. My deep appreciation for the Leadership Council, their fabulous leaders, their fabulous staff, all of the people who put this on today, LA County Department of Public Health, Board of Supervisors, all the organizations and survivors in this room. Thank you for your partnership in this work. So I'm really excited about today's sessions. I hope you all are too. This is really a very special convening, very special gathering. There's nothing else like this in the state. So I really appreciate just the way that the Leadership Council brings us together, helps us learn from each other, to think about kind of new strategies for making change for our clients and survivors. For almost 2 decades, Blue Shield of California Foundation has partnered with organizations, leaders, and advocates throughout the state and across the nation with the goal of ending domestic violence and creating safety for survivors. We've learned domestic violence is everywhere, but it's healable and it's preventable. It affects 1 in 2 Californians. It affects children, extended families, and entire communities. It's rooted in entrenched gender norms, racism, and income inequality. It's not a private issue, but a societal one that we can and must collectively work toward preventing. To break this multi-generational cycle of domestic violence, at the Foundation, we focus on healing and prevention by directly addressing root causes. This means focusing on community-rooted prevention solutions, including restorative approaches that address the diverse needs of communities and families of color. We must also promote healing from trauma, as Lan mentioned, to stop the multi-generational impact of violence, because we know that children exposed to domestic violence are more likely to experience it as adults. As you heard, since 2013, it's really been a decade, wow. The Foundation has supported efforts to break down silos and promote collaboration between the healthcare sector and domestic violence organizations. So we've been pleased to support the domestic violence healthcare partnership efforts here in LA County through the work of the Leadership Council. You all are definitely the leaders in California in thinking intentionally and proactively about collaboration between healthcare and domestic violence organizations. So kudos to you all. As a health funder, Blue Shield of California Foundation has seen a growing awareness in the healthcare sector, the importance of social supports for the health and well-being of all Californians, but especially marginalized populations. Communities that lack affordable housing, healthy food, and safety from interpersonal and domestic violence have more negative health outcomes. More and more, we see health policymakers seeking to address these social drivers of health by leveraging healthcare programs such as Medi-Cal to make investments to more holistically promote individual health. A growing evidence base has established that addressing drivers of health can improve outcomes and do so more cost-effectively and equitably than medical interventions alone. Medi-Cal's investing billions of dollars to extend supports and services for Medi-Cal enrollees beyond hospitals and clinics directly to communities and community-based organizations. The state's vision is to meet people where they are in life and address their social needs. On our part at the Foundation over the last couple of years, we've worked with the Mathematica consulting firm, with Futures Without Violence, who you'll hear from this afternoon, California Partnership, and some of you in this room to imagine how Medi-Cal could do a better job in addressing and preventing domestic violence. We put out a number of issue briefs on these topics that you can find on our website, and we're in active conversation with Medi-Cal about how the program can invest more deeply in promoting education about domestic violence, in addressing the social support needs of survivors, in expanding access to behavioral health services, and in supporting survivors' privacy and confidentiality needs. So if you'd like more information, please come find me. Happy to share more. I want to talk a little bit about what we're working on at the Foundation. First, I have some great news. Lucia Coral Pena, who led our Break the Cycle of domestic violence work for the past decade, recently was promoted to our Chief Program Director. overseeing all our program work, so we're excited about that. Thank you. And so I'm delighted to announce that we recently brought on board a new senior program officer to lead the Break the Cycle work, Carolina Morales, who's here today. So she comes to us with a great background in working on violence prevention as a past co-executive director of Community United Against Violence in San Francisco, then a staff to a San Francisco County Supervisor and the District Attorney. So please make sure y'all introduce yourself to Carolina before the day is out. At the Foundation, we're also in the process of recording and releasing podcasts for DV Awareness Month. They're on the website let'senddv.org. And there we're talking about 4 issues that are top of mind for us. And these are really interesting podcasts, so I think you all would you'd find them interesting. I certainly do. So 4 issues top of mind for us: multi-generational approaches to violence prevention, the use of restorative practices as another way for survivors to find healing and justice, the importance of bringing a survivor lens to our programs addressing housing and homelessness so they work better for survivors, something I know you all work on a lot here in LA, and a deep dive into domestic violence prevention in the African American community. So they're not all up on the website yet. We haven't recorded all of them, but they're getting there. Please check them out. They're really full of great information and insights from field leaders across California, give you some more details about the Foundation's current work. So again, thank you all for coming today. I really look forward to spending the day with you and learning from all of you and from our great speakers. And thank you for addressing the opportunities and challenges that you see in your communities to better meet the needs of survivors. Thanks.
Good morning. My name is Deborah Ward, and I'm with the YWCA of San Gabriel Valley, the CEO. I'd like to welcome all of you as I introduce and present our Board of Supervisor, Hilda Solis, who will give us greetings. She wasn't able to make it today due to her busy schedule, but she did bring greetings through a video. And I just want to kind of thank the Board of Supervisors publicly, because all 5 have been so supportive of this conference from the very beginning. And we continue to bring at least one every year to express and continue to encourage us in collaborating to go beyond silos, to work together, to integrate, to be able to work not only with healthcare, but social and human services providers, but that multi-sector work is really important. So at this time, many of you know the supervisor. She comes from the San Gabriel Valley. She represents areas of Northeast Los Angeles and east side of Los Angeles County. Many of you know that prior to her coming on as the Board of Supervisor, she served as Secretary of Labor under President Obama, the first Latina to ever serve in the presidential candidate. I have known her from many years working in South Los Angeles and her work at the state level, both in the Assembly and the Senate. She continues to be a beacon of hope and public servant in our Los Angeles County and represents us well. So at this time, if I could bring your attention to the closest video, I'd like to introduce the Honorable Hilda Solis.
I want to thank the Domestic Violence and Healthcare Partnerships for hosting this year's Beyond Silos Summit. I want to give particular thanks to Genesee Center, East LA Women's Center, the YWCA of San Gabriel Valley, Community Legal Aid Southern Cal, Blue Shield of California Foundation, and the Department of Public Health. And of course, the California Endowment for hosting. Domestic violence and intimate partner violence are serious public health issues. 1 in 5 women and 1 in 7 men report having experienced severe physical violence from an intimate partner in their lifetime. It is devastating and destructive conduct that hurts not just the survivor, but our society at large. With the efforts of each of you, we are improving the safety net for survivors. The work that you all do is critical. Survivors depend on your timely and sensitive services for care and healing. And having a space to discuss what you are all experiencing and sharing best practices can make a huge difference in the life of a survivor. This is why this symposium is so important. We need to wrap around survivors and provide them with housing, childcare, mental health services, and job training, whatever it takes for them to live full and healthy lives, and extends to their health needs. We know that our hospitals and our healthcare partners are often the first place domestic violence survivors go after they endure serious trauma. But domestic violence is a seriously overlooked problem with detrimental effects on the physical and mental health. In 2019, National Library of Medicine study is revealing, although based in Europe, it found that only 4.8% of patients who experienced domestic violence were asked about domestic violence at the hospital, despite the fact that over 60% of the survivors search for assistance in the health system. It is why it is so critical that you are all coming together to partner. Cross-sector partnerships will lead to the best solutions for survivors, and we need to empower each other so that we can empower those we serve. Integrating domestic violence prevention and resources in a health setting is a best practice. Silos prevent our residents from getting the care that they need, and this is especially true when it comes to domestic violence. There are incredible organizations in this room that provide shelter, counseling, and more to domestic violence survivors. These are resources our healthcare partners want to offer their patients, and so I'm glad you are all coming together. Our work is not finished. We can't give up. We stand in solidarity with those who have endured domestic violence, and we continue to help survivors through their journey and simultaneously work to educate others to prevent and end domestic violence once and for all. That is now true more than ever with the COVID-19 pandemic these last 3 years. It is time to fight back against misconceptions that surround domestic violence. It is time to believe survivors. Thank you very much.
We want to thank our sponsors, the Blue Shield of California Foundation and the National Health Resource Center on Domestic Violence.